So I'm going to talk about plantar fasciitis today. Plantar fascia is very thick, strong, and wide structure covering our entire foot. Plantar fascia looks like this, and middle part looks like white. This is called plantar aponeurosis, which is also part of the plantar fascia. And outside and inside of the foot are also covered by plantar fascia, and it attached to the heel bone to each toe. So it is very important to maintain our foot stability, especially when we are standing. There are also so many different structures connected to the plantar fascia, such as foot intrinsic muscles like toe muscles, and ligaments, and even calf muscle, gastroc and soleus. Gastroc, soleus are going to be Achilles tendon, and Achilles tendon attached to heel bone, calcaneus, right? So here's Achilles tendon attached to the heel bone, and one research showed that there is a thing, but there's a sheath on the calcaneus. So the research said this sheath can connect Achilles tendon to the plantar fascia. So the tension on the calf muscle can influence on the tension on in the plantar fascia. So that's why physical therapists provide calf muscle stretching to decrease the stress on the plantar fascia. I'm going to talk about the symptoms of plantar fasciitis. Plantar fasciitis is an inflammatory response in the plantar fascia. So if we put too much pressure or stress on the plantar fascia, it gets inflamed and painful. In terms of population, anyone can have plantar fasciitis, from young top athletes to older population having sedentary job or desk work all day. One of the most common symptoms of plantar fascia is when they have initial steps in the morning or after long period of sitting. So just because of the position of the foot during the inactivity. So I'm going to demonstrate on you. When you lay down, your feet are going to point down. As a result, your toes are curved down and ankle is going this way. In this position, your plantar fascia is shortened, and then in the morning you wake up, you're gonna put your weight to the plantar fascia in stretched position. That's when people have symptoms or pain in the morning or after a long period of sitting. One of the best treatments for the plantar fasciitis is to use night sprints or foot orthosis, just because night sprints can keep plantar fascia stretched position all night. So you can keep it stretched, then in the morning you don't have to experience that much pain on the plantar fascia. Same thing for the foot orthosis, it gets stretched and you don't have to experience that much pain. So what causes plantar fasciitis? One of the main causes of plantar fasciitis is a change of activity level. So for example, if we want to be active because of your sedentary lifestyle, you should start exercise very carefully. If you do 2 hours of exercise, like very fast pace, very intense workout, you're gonna have pain not necessarily in foot, or you might have knee or hip pain or low back pain or even shoulder pain, neck tightness, and so on. So for example, you should maybe start with 20 minutes of very slow paced jogging, and then progress to 25 minutes of slow paced jogging, and then going back to 20 minutes of a little faster pace of jogging, and then 30 minutes of jogging, a little faster pace, something like that. So yeah, you have to be very careful to progress the intensity, otherwise you're gonna have pain somewhere in your body. Another reason to have foot pain is high or low medial longitudinal foot arch. but there are so many different reasons to change that arch height, so I don't say specific reasons. You might have a very weak ankle or tight ankle, knee, or weak hip muscles, weak trunk, or even asymmetry of pelvic or upper body. So it depends on the person. So you have to ask doctor or physical therapist to know what causes your change in medial longitudinal arch. Finally, I'm going to talk about the treatment. So as I said, night sprints or foot orthosis can be a good option to treat morning pain or the daily activity pain. Taping to support plantar fascia is also effective based on the research. Like I said in the beginning, plantar fascia can be stressed with different structures such as toe muscles or calf muscles, so stretching those muscles can be also effective. Manual therapy is also effective, so visiting PT should help your symptoms. Some people have good outcomes from shock waves or cortisone shot, but it is still controversial because of some effectiveness and also side effects. Usually people try those modalities only if other treatment options don't work, so you should ask doctor or physical therapists. This time I explained about plantar fasciitis and its treatment. This is very general ideas of how we advise or treat patients, but each person has totally different issue. So you can try those techniques I mentioned here, like stretching and night sprints, but I highly recommend you visit physical therapists to know what exactly causes your pain. You may have different diagnoses such as tarsal tunnel syndrome or lumbar stenosis, which have similar symptoms to plantar fasciitis. So if you have any physical concerns or questions, just please ask physical therapists. Thank you for listening to my speech.